Passion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois presents, oh, and we're in the USA, of course, this week's breaking news in wellness and health for all people and for all professionals. Welcome. I'm the Pete of Dr. Z and Pete, and we are here today to discuss wellness and health and these. I'm the president of Bethel House of Refuge, Muhammad, Illinois. Previous to that, I was the president of a commercial construction company operating in the East Central Illinois area. I and my lovely wife, Stephanie, reside in Farmer City, Illinois. She is a travel specialist with the University of Illinois Electronic Computer Engineering. Mm-hmm. This fellow on my left is my distinguished co-host, Dr. Alex Rama Zechariah. Doc is also a medical professor, and he is the CEO of CNN4All International. Recently, Doc was the chief medical officer, the medical director of Provena, now Presence United Samaritan Medical Center in Danville, Illinois, a post that he held all of 2008 and part of 2009. Prior to that, Doc was the dean of one of the top 12 medical colleges in India, Ludhiana, Christian Medical College in Ludhiana. It was 12 out of 300. Doc, with his wife Prema, also a retired physician and professor. What if they said, is there a doctor in the house? You got two or three of them. 43 years at Christian Medical College in Ludhiana, first as medical students and then as staff professors. They retired in 2000, now live in Urbana, Illinois, where they've been since 2005. Doc, excellent resume. Got a lot of information, and you have a lot of experience. That's why we are together today. Would you please tell the folks what breaking news is all about?
Yeah, please note this is not medical advice. This is for your information only. Don't change your treatment based on this info. You must ask your doctor if you change anything. You can ask your doctor to watch this.
Yeah, ask him to watch. We invite all watchers. Ask him to watch it and give us some feedback.
Yes.
You can give us feedback. If you'd like, email breakingnews@CNN4All.com. All right, well, let's get right into this week's topic, cancer statistics 2014. Death rates continue to drop. The annual cancer statistics report from the American Cancer Society finds steady declines in cancer death rates, Doc, for the past 2 decades, add up to a 20% drop in the overall risk of dying from cancer during that time period. Says a lot about research, doesn't it?
Absolutely. The report, the Cancer Statistics 2014, finds progress has been most rapid for middle-aged black men, among whom death rates have declined by approximately 50%.
Oh my.
Despite this substantial progress, black men continue to have the highest cancer incidence and death rates among all ethnicities in the U.S., about double those of Asian Americans, who have the lowest rates.
Boy, that's stunning. I mean, I'm stunned. I didn't realize that. Okay, green spaces deliver lasting mental health benefits. Green space in towns and cities, parks and the like, could lead to significant and sustained improvements in mental health.
That's why you are in Farmer City.
Yes.
New study published in the Journal of Environmental Science and Technology, January 2014. The study from the University of Exeter Medical School, UK, I was been to Exeter, analyzing data that followed people over a 5-year period. The research has found that moving to a greener area, as you have done, not only improves people's mental health, but that the effect continues to long after they have moved.
I'm in the Greenview subdivision, too. Definitely proof positive.
Yes.
Racism may accelerate aging in African American men. This new study reveals that racism may impact the aging at the cellular level. Now, I got a question. Researchers have signs that accelerate aging in African American men, ages reporting high levels of racial discrimination and who had internalized anti-black attitudes.
Yes, this is it. The study published, they are hurting themselves.
Yeah.
The study published
That
in
was my question.
the American Journal of Preventive Medicine, January 2014, was the first to link racism-related factors and biological aging. The research showed that social toxins disproportionately impacting African American men are harmful to health. They need to stop internalizing. That is very important.
The study is saying that
Yes.
people,
Yes.
you're talking about African Americans
Yes.
that feel like they're discriminated
Yes.
against. They internalize things that
and they
work
age-
against them on the
age
cellular
faster.
level.
You have to get out of that.
Yeah.
And you are set free.
You know, I was talking to my Sprint representative, who
Yes.
happens to be an African-American male,
Yes.
and he said that very thing. He said, I can't dwell on negativity.
Absolutely.
Great guy,
Yes.
Sprint.
Very good.
Yeah, very good.
Yeah, this is applies to all of us.
You bet.
Yes.
Workplace wellness programs can cut chronic illness costs. Workplace wellness, that means prevention. They can lower healthcare costs in workers with chronic diseases, but components of the programs that encourage workers to adopt healthier lifestyles may not reduce health costs or lead to lower net savings.
According to a new RAND Corporation study published in the Journal of Health Affairs, January 2014, researchers found that the disease management program reduced costs among participants by $136 per member per month, or $1,632 annually, driven by a 29% drop in hospital admissions among people who participated in both the disease management and lifestyle management program. The savings were $160 per month, with a 66% drop in
goodness.
hospital admission.
I can afford
out.
that.
Yeah.
You know what I'm saying? $160 a month, that's not chump change.
Yes, absolutely.
Yeah, for most of us, that's a substantial...
Get moving.
You bet.
Yeah.
Treat yourself.
Yes. Yeah.
Overuse injuries, burnout in youth sports can have a long-term effect, Doc. As an emphasis on competitive success, that's winning at all costs in youth sports has led to intense training, frequent competition, and early single sport specialization. Overuse injuries and burnout have become common.
This is
Burnout is ahead.
Yeah. Given these concerns, the American Medical Society for Sports Medicine has released a new clinical report that provides guidance to physicians and healthcare professionals who provide care for young athletes.
Right. My grandsons are competing, and they're now training and doing all this stuff. For the 60 million U.S. children and adolescents between 6 and 18 years, that's them, who participate in some form of organized athletics, youth sports can be very enjoyable and very beneficial. However, an emphasis on competition, collegiate scholarships, and elite level successes, NBA, MLB, NFL, has led to increased pressure to begin high intensity training at young ages, often in only one sport. I've seen it with my eyes, Doc. Consequently, overuse injuries, because you're using the same muscles, same bones, same function, they cause burnout and are affecting many of our young athletes.
Oh, take note.
You bet. Parents, stop living vicariously through your kids.
Yes.
Meditation for anxiety or depression. Some 30 minutes of meditation daily may improve symptoms of anxiety and depression. A new Johns Hopkins analysis of previously published research suggests that this is so. That means even 30 minutes in the Bible could help you.
See, every believer is doing that.
Yeah.
This Johns Hopkins University School of Medicine published online January 6, 2014 in JAMA
news.
Internal Medicine. The study showed that meditation, Bible reading, prayer, quiet time appeared to provide as much relief from some anxiety and depression symptoms as what other studies have found from antidepressants. These patients did not typically have full-blown anxiety or depression.
Okay, so they're telling you the niche in which
Absolutely.
this is, and it's got to be helpful in almost any of them.
Anyone.
Check this out, Doc. Loving touch, critical for premature babies. The infant that premature infants gain, that the effect that they gain, skin-to-skin contact with their mothers, is measurable even 10 years after birth. A report shows in a study in biological psychiatry.
Yes, the study was published in the Journal of Biological Psychiatry 2014. 73 mothers provided skin-to-skin contact, kangaroo care,
Yeah.
KC, kangaroo care, to their premature infants in the neonatal unit for 1 hour daily for 14 consecutive days. For comparison, the researchers also assessed 73 premature infants who received standard incubator care.
Not the same.
No, children were then followed 7 times across the first 10 years of life.
Man, and Doc, in this decade-long study, we
Yes.
show for the first time that providing maternal newborn skin-to-skin contact to premature infants in the neonatal period improves
Yes.
that child's functioning even 10 years later. That is magnificent.
Absolutely. Kangaroo. Get
Oh,
them.
yeah.
Get them on to
Well,
you.
my daughter just had a baby the 29th of December, and
Yes.
they put that baby right on her, and she did not leave it. The nurse did not touch her, the midwife, for an hour and a half.
Wow. Awesome.
Yeah, I mean, and she is so laid back.
Yes.
Okay, we're going from babies to dietary fibers that protect against asthma.
Asthma.
The Western diet probably has less to do with the asthma epidemic than has been assumed so far, because developing asthma
Yes.
is related to the amount of fruit and vegetables consumed.
So the more fruit and vegetable you consume, the less
I've heard that
you like
before.
to. This Swiss study was published in Nature Medicine, January 2014. In the West, an increasing number of people have developed allergic asthma in the past 50 years.
Oh, my.
But dietary habits have also changed during the same period. Fruit and vegetables are playing an ever smaller role in people's diet. The Western diet probably has more to do with the asthma epidemic than has been assumed so far, because developing asthma is related to the amount of fruit and vegetables
Oh, my.
consumed.
That's eat more.
Eat more.
Old Doc
Yes.
Yoha will be
Yes.
happy.
Yes.
Well, as if cancer and heart diseases were not enough motivation to make quitting smoking. Here it's like beating a dead horse. Your New Year's resolution. Here's another wake-up call.
Yeah.
Want a good night's sleep in the new year? Quit smoking.
Yes, new research published in the January 2014 issue of the journal suggests that the smoking disrupts circadian
Yes.
day-night clock function in both the lungs and the brain. Translation: smoking ruins productive sleep, leading to cognitive dysfunction, mood disorders, depression, and anxiety.
I'm going to tell you.
Yes.
I know a smoker that can't sleep. Are you kidding me?
And you smoke more.
Blue Monday, brutal cold short days.
Yes.
Post-holiday letdown raises the risk of depression.
Yes.
The first Monday after the holidays can be a depressing time for people coping with post-holiday letdown and a type of depression triggered by short days called seasonal affective disorder.
Sad.
How
It's really
appropriate.
sad.
And after this year, first Monday will be especially blue due to the added stress of the brutal cold
Deep
that we have
freeze.
experienced.
Yes. This according to Loyola University Medical Center, Chicago, obviously, in the deep freeze.
Oh, yeah.
All these factors will have a cumulative effect. And one could see an uptake in depression this coming week and for the rest of the month. Okay.
All right, well, listen.
Yep.
In spite of the cold, I think I saw Dr. Ross's agent. Is he going to be with us?
Yeah, absolutely.
All right, we're going to be back with the panel discussion. We got to go get Dr. Ross out of the green room, so we'll be right back.
Compassion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA presents this week's breaking news in wellness and health. for all people and all professionals. Hi, I'm the Pete of Dr. Z and Pete. Of course, this is Dr. Z, Dr. Alex Raymond Zechariah. He is also a medical professor and the CEO of CNN4All International. I'd like to welcome you, Doc, our distinguished medical professional, and, well, actually, Dr. Raymond is our more distinguished medical professor, and this fellow on my right is a distinguished medical expert as well, Dr. Ross Yoha. Welcome to the program, Dr. Ross. We're looking forward to a lively discussion with you today. How are you doing?
Thank you. Good to be here, sir.
Excellent. Glad to have you with us. We're going to jump right in today. We're talking about diet and diabetes. This is one of your expertise areas, right, Doc?
Absolutely.
Okay,
Look at me. I'm,
yep,
I'm,
thin as a
I'm
pin.
fit.
Fit as a fiddle. Well, let's jump right into it. We've been talking a lot about the link between diet and heart disease, diet and diabetes, and I want to know how that diet and diabetes is linked.
You know what? The number of diabetics worldwide is exploding.
Yep.
In
boy.
response, the largest study of its kind to date is 8 EU, European Union nations, along with New Zealand, Australia, and Canada, is set to investigate type 2, that is adult diabetes prevention, through diet, exercise, and lifestyle.
Oh my.
This EU-funded project headed by the University of Copenhagen researchers. You know, the project is to find the most effective combination of diet and exercise and lifestyle related to type 2 diabetes.
Doc, I am seeing a lot more people in my age group that are affected and suffering with type 2 diabetes, and I can tell you, visually, it looks like it is affected big time by diet.
Absolutely. So it means eat more.
Eat more?
Yeah, eat more and eat well.
Yeah. More of what, Doc?
More of veggies, whole grains, fruits, go nuts on nuts.
Yes, I agree.
But eat less.
Eat less what?
Eat less, yes, eat less. Less of fried food, starch, sugar, say no to soda pop.
Even say no to soda pop? You can't have soda pop?
No. You know, you know the Purdue University researchers reviewed dozens studies published in the past 5 years that examined the relationship between consuming diet soda and health outcomes, and they found it is not good for one's health as it confuses the body.
Well, I've seen, I have a friend that has a dystrophy type disease, and he was drinking Diet Cokes right and left, and his doctor told him to stop it, that whatever's in that Diet Coke has the ability to affect the expansion or retraction of that disease. So that kind of validates your position, doesn't it, Doc?
It confuses the body. It's not the real thing. And when you have the real thing, what less?
All right, so now we know that diet and diabetes are connected. Give us some diet advice, Doc. What kind of diet is best for combating the effects of diabetes?
You know, as I said, eat more,
Oh,
more of veggies,
yeah.
fruits, and whole grains.
Yes.
Go nuts on nuts. You know what? New research found that both Mediterranean, you know, the Mediterranean diet,
Mediterranean
diet and diets low in available carbohydrate, they found that this is good for type 2 diabetes. New research shows that Mediterranean style diet and diet low in this carbohydrate can offer protection against type 2 diabetes.
So your fresh foods, vegetables, fresh fruits, that'd be salad, fruits.
You got it.
Fresh vegetables, and raw as much
Yes.
as possible, right?
Yeah, the study is published in the journal Diabetology 2013. And
Okay.
the study suggests that the protection of the Mediterranean diet, or the diet of Mediterranean type of diet, which you and I
Olive
take.
oil,
That's
wine.
right, yeah. Because diabetes is It's even without losing weight. You don't have
There's
to
still a
lose
benefit.
weight. It's still beneficial. And so that's a very important thing.
Doesn't it help reduce your high density lipoprotein?
You got it.
Hey.
Yes, and low density. It reduces the low density.
Sorry, and it increases
Increases
the high density.
It increases the high density lipoprotein
Yes.
and decreases the low density lipoprotein.
All right, so for our viewers, LDL, low density lipoprotein, is the
It's a culprit.
culprit, is the problem. That's the one we want to work to reduce.
Then he's the bad cholesterol.
And the high density lipoprotein is our friend.
That's right.
we
High
want it
density
increased.
lipoprotein is
Okay.
our friend. But not only that.
And it all comes from fat, right?
That's right. That absolutely. But that fat, and something more.
Okay.
Exercise more.
Ooh.
5 times a week. Half hour or more till soaked in sweat.
Exercise more. Sometimes that's a bad word for some people.
No, exercise more. Walk, jog, run, bike, treadmill, elliptical, till soaked in sweat.
So your basic advice to people that are, I mean, it could be the same, right, Dr. Yoha, that people that have issues, genetic, physical, heart problems, cardiac issues, issues with diabetes, they can affect their overall health by simple things. Stop smoking.
Got
Man,
it? You got it.
change your diet. Stop eating processed foods and the garbage that comes off potato chips, cookies, pizzas, all this greasy food, and begin to eat fresh fruits, fresh vegetables. Stay away from most oils. Olive oil is the oil of choice.
Very
And-
good. And
yeah, so-
if you want a little bit of butter, no problem.
Yeah.
Not margarine, not liquid
No.
plastic, not liquid plastic.
Yeah, I tell you what, I prefer butter, and I'm learning salt is another one. We've talked about that, Doc, in the last few episodes, that salt can be a problem if you overuse it.
Absolutely. Yeah.
So we need to be moderate in what we're doing.
Don't take your salt bottle and start shaking on your food.
Oh, my goodness.
Don't-
Before you even taste it, right?
Absolutely.
Just habit.
Keep that salt bottle away.
And exercise critical?
Yeah, very important.
Yeah.
Exercise more, 5 times a week, half hour or more till soaked in sweat. Exercise more,
More.
walk, jog, run, bike, treadmill, elliptical, till
Till
soaked
in
in
sweat. Well, Dr. Yoha, we really appreciate your advice, your insight, and your medical
So remember,
expertise.
diet and exercise.
Diet and exercise.
And we must treat ourselves,
Selves.
not doctors.
Yes, an ounce of prevention worth a pound of cure. So listen, we'd like to thank Science Daily for all the information that they've given us, that you know this is absolutely breaking news. We'd also like to thank the City of Urbana, the UPTV production team, our coordinator, Jason Liggett, the one, the only, our intern, Caleb Serpenis, our three-camera intern, Jacob Bernhardt. We want to thank all those fellas and all they do for us on a weekly basis. Also would like to thank the Chorister Fellowship in Keeravala, Kerala, India, for the music score and the Hallelujah ending.
Hallelujah.
You betcha. We'd like to thank Dr. Ross for being our guest, Dr. Alex Rama Zechariah for being our resident medical expert, and we would like to thank you for watching. We'd invite you to turn in. Same time, same station. God bless you. Thanks for watching.